to your page.
Okay.
And she's looking at it right now, so she's
Welcome, everybody. This talk today is part of the Accords series, and my name is Lori Crane. I'm a professor at the Colorado School of Public Health in the Department of Community and Behavioral Health, and I have been doing surveys for over 30 years. I was going to say 4 decades, but I decided to just say over 30 years. And oh no, I guess I just said both. Anyway, and I also have taught a survey design course, and I give short talks like this on surveys. So I have a lot of experience doing surveys, all with some relationship to healthcare. Many surveys with physicians and other healthcare providers, as well as patients, as well as people in the community on a number of different disease areas and topics. There's my name. Okay, so what we're going to do today is we're going to just fire through a lot of things related to surveys. We're going to cover how you pick a mode of survey, the steps in survey development, how to write survey questions, how to organize and format your survey, the importance of pre-testing and pilot testing, the importance of picking a sampling frame, and the importance of achieving a high response. And I think my next slide pitches next week. Misha Britnikova is going to be talking about survey nuts and bolts in this same conference center, but I think not this same room. But Snowmass room, and I would encourage you to go to that because she's going to really get into more of the detailed level of how you actually pull things off. So I want to emphasize you're not going to learn everything you need to know about surveys in this 1-hour session. They are more complicated than I think that they seem at the outset. And there is a course in the Colorado School of Public Health here on campus actually it's an online course, so you can access it from anywhere in the world that has internet. And it's offered in spring, so you might want to think about doing that. And then in terms of books, we're handing out the slides for this, right? Okay. So I'm not going to go through what these books are, but there are a list of books that I recommend. Why is that slide blank? Oh, no, it's not. Okay, so we're going to start out by talking about picking the mode of survey administration. And these are the typical, what we would refer to as modes. So you can do surveys face-to-face where you sit down and talk to a person and collect information from them. You can do them over the telephone. Telephone can be with a live person. It can also be with automated voices and systems where you put answers in through your keypad on the phone. There are self-administered surveys using paper and pencil that could be done through the mail, or group administered, like we're sitting here today. If we wanted to do a survey here with you sitting here, we'd call that group administered. And then, of course, we can do surveys over the internet. So the choice of a survey method needs to match the needs of the study. And you need to be taking into account the characteristics of the population that you're surveying. So things like literacy, hearing, eyesight need to be taken into account. The complexity of the information that you need is very important. So if there might be instances where you want the respondent, and that's what we call the person answering the survey, you want the respondent to be able to review records. So for example, you might be asking, how much did you spend out of pocket for medical care in the last year? And you might actually want them to review their records and give you a very accurate answer. There are also what we call skip patterns, where based on the answer to one question, a person would skip to another part of the survey. And those can get very complex. And so that's another thing to consider when you pick a mode of survey. And then the availability of a sampling frame and a sampling strategy. So sampling frame is the list that we use to contact people. And regardless of, for whatever mode that you're going to do a survey, you need to think about how you're going to get the information that you need in order to contact people, and how you're going to get a good list of that information. And then time and money obviously come into play when you're deciding about how to do a survey. So internet/email surveys are the cheapest, because except for the time it takes programming the survey, And maybe you may have to pay a fee to whoever's administering the survey, like SurveyMonkey, or we've used a company called Vovici, and there's others. You may have to pay a fee for that. But other than that, you can administer a survey for free. You can get very quick turnaround. In fact, there are studies showing that the majority of, or the biggest response comes within minutes after you send it. So minutes, hours, days, you can get a survey done quickly. But your population obviously has to have access to the internet. You have to have a good list of email addresses. So you have to be able to contact people and ask them to complete the survey. You can obviously cover a wide geographic area with an internet survey. You need a fairly highly literate population because you need people that are obviously able and comfortable with using the internet. They need to be able to read the questions, although you could program one with audio so the questions are read to somebody, but they still need to be able to get to the site and take the survey. Confidentiality is an interesting issue with the internet surveys. You can actually set them up so that they are anonymous and you don't know who the respondent is, but people may not believe that it is truly anonymous, and that may influence their responses. If you were asking about something very sensitive, like, for example, if you were asking about illegal drug use, somebody may assume that because they logged on and they contacted your website that you can trace their, what is it, IP whatever? What is it, IPS? Or, yeah. So, but there are ways to block that information to make it truly anonymous, but people may not really believe that it's truly anonymous. It's important to pay special attention to the visual appearance, because now some people will, or many people will be doing it on their phones, and some people might be doing it on a very large computer screen. So you really need to think about those things when you design an internet survey. Probably the main reason to not do an internet survey is low response rates. And I'm talking really low, like 1 or 2% is what you might expect to get depending on the population you're trying to get to respond. So in general, people are going to be more likely to respond to a survey if it's something of interest to them, something that they're passionate about. So you might only get the 1 to 2% of the people who are either bored or really passionate about your survey or your topic, and that's going to be really important in biasing the responses that you get. One way to overcome that is to pre-recruit people. So there are these panels that people have created where they've pre-recruited representative samples from the population, and you can then tap into these. You can buy your way into these samples that are supposed to be representative samples, and you'll get a higher response rate than you would if you just sent your survey out randomly to people's email addresses. The next mode that I'll cover is self-administered surveys. I'm talking about written surveys because internet surveys are also self-administered. The cost is also low for written surveys. I put $1 to $15. It actually could be more expensive than $15 if you do a full protocol. So a full protocol to do a high quality mailed survey would be at least 5 contacts to the respondents. So obviously you're not going to mail people things 5 times for $1. Response rates are low, but they're not as low as an internet survey. You might think that people don't look at their mail, but they actually probably look at their mail a little bit more than they look at their email. So response rates with a good protocol could be from 25 to 50%. The potential for bias is still high because, again, you're going to get the people who are more interested in the topic that you're surveying them about. There are issues with completeness. So think about when you get a paper survey in the mail, you might not, or a person might not complete the whole thing. They might accidentally skip a whole page. I've seen that happen where you're entering the data and there's a whole page missing. And it's probably because they turned 2 pages at the same time, but we don't know. So there's issues with completeness. They need to be short, and the recommendation is they need to be less than 125 items. And you might think, wow, that's a lot of items. That doesn't seem short. But when we count items, It's typical in a survey to have a table where you're asking people whether they agree or disagree to a number of different things. Every one of those is an item. So maybe you have 10 questions in a table. Those are 10 separate items. You have your demographic questions. Those are going to probably be another 6 or so items. So you can get up to 125 items pretty quickly. We have no control over question order in a written questionnaire. And by that I mean sometimes we intentionally want people to answer certain questions in a survey before other questions. And my example for that would be perhaps we're measuring satisfaction with medical appointments, and we want people to consider, well, let's say we want to get their overall impression of a medical visit before they start thinking about individual aspects of that medical visit. So we want their gestalt of how was that medical visit. So we start with a broad question about satisfaction with a medical visit, and then we want to systematically go through different aspects of that visit, like the level of knowledge of the doctor, and the amount of time they had to wait, and the physical appearance of the clinic. We might have specific things, and we may want them to not take all those specific things into account when we ask that first overall question. But in a written survey, we have no control over that. We can ask them in a particular order, but they can go back and change answers. They can skip around as they do it. We also have no control over who responds unless they're sitting in a room like this one and we're watching and making sure that the person we handed the survey to is the one who responds. But when you send it to someone's house, you don't know if you were trying to get the opinion of the primary householder, but one of their kids completed the survey and sent it back in. There are clearly literacy and vision issues to consider with a paper-based survey. There's no ability to clarify or probe. So if someone gives you an answer, you don't really know what they meant by that answer. And you can really only clarify or probe an answer if you have a person delivering a survey. So either over the telephone or in person, you have the ability to ask follow-up questions and make sure you understood what they meant by a particular answer. If you do it by mail, a good protocol will take you at least 6 weeks to complete. So in contrast to the internet where we could complete a survey in a couple of days, if we're going to do it through the mail, we're going to need at least 6 weeks. You need a mailing list, obviously, and that's not necessarily easy to acquire, but you can make mail surveys completely anonymous, and there are some creative and interesting ways to do that. Telephone surveys are, I would say, the next bump up in terms of cost. A standard protocol is to do 12 to 20 contacts, and you sometimes will have to argue with the IRB about to allow you to do that, but that would be an acceptable protocol. Response rates are higher than they would be for a written survey. Accuracy is higher because I'm speaking about surveys where you actually have a person delivering the interview. Other ways where you have an automated voice, maybe you won't get as much accuracy. Responses are abbreviated, which means people give shorter answers over the phone than they would if you were sitting there talking to them. You can do surveys up to an hour long. I've done telephone surveys where it took up to an hour and a half to complete some surveys. And as long as, I know people are like shaking their heads like, how could that possibly be? I wouldn't stay on the phone for an hour and a half. But it depends on the population. The one where I did it, they were women who were Medicare patients, so they're all over the age of 65. They had all had breast cancer, and it was about their choice of treatment for breast cancer. So women were very engaged in that topic, and some of the interviews lasted an hour and a half. There's the greatest ability for supervision. So what you would typically do is you'd set up maybe a room like this with in this room you could probably get at least 10 cubbies with interviewers working individually, completing surveys, and you can have a supervisor who can push buttons and listen in on any of those surveys at any time and monitor the quality of those surveys. So telephone is really your best bet if you really feel if you need to monitor, and I really can't underemphasize the importance of monitoring the quality of surveys being delivered. They can also be completed very rapidly. Political surveys are done within a couple of days to find out what the population is thinking prior to an election or some other important political event. You can use computer-assisted technology. Yes?
Can you distinguish between cell phone and landline? Are there differences in those?
There sure are, and I'm going to say I don't have time to go into it because it's huge. It's huge, and it's a problem that's emerged in the last 10 years, and there are huge sampling issues about it. So thanks for the question. Sorry, I can't really address it. Yes?
When you said the number of contacts, do you mean the number of times you attempt to reach a person?
I do.
Like once you reach them and then if there are times you call them back and follow up?
Yeah, so I mean the number of times you try to contact them. And then when you reach them, I mean, my experience is, and I know there are people in the room who do, this is what they do for a living, Allie. So that, once you've gotten them once and they say, well, I'm too busy right now, then you may have a different protocol where you're not going to call them another 10 times. Or you might. Let's see. So computer-assisted technology, what we would typically do is each interviewer would have a computer terminal, and they're reading the questions off of that screen, and they're entering the answers. And so we don't have an issue of data entry later. The data entry is happening right when that survey is being conducted, which really speeds up the ability to process the data. It also reduces the possibility of errors because the computer can control that you ask the right questions and you only enter acceptable answers. Yeah.
I was going to say, in terms of skip patterns, you don't have that problem.
Right. Right. So the skip patterns, very complicated skip patterns, can be administered in a telephone survey. It's probably the best. Internet surveys, you can also do complicated skip patterns, but any computer technology is really going to improve the delivery of the survey related to skip patterns. There are certain populations that are less likely to respond. I realize I just skipped that. Sampling can be difficult and costly, and this is my little nod to that issue of cell phones versus landlines and the complicated way that we now assign telephone numbers, and you can take your telephone number with you across the country. I think if it's a landline or a cell phone, you can hang on to that phone number with that area code, and that has really complicated the way you do telephone sampling. So that's all I'm going to say about that. There are certain populations like young adults and males that tend to have lower response rates over the telephone. And then face-to-face surveys, this is where you're sitting down in person with somebody. They're going to cost, I have $100 plus. They could be cheaper if you were doing a clinic-based survey and you're interviewing patients when they come in for their appointment. You might be able to do it for less than $100 a person. I'm thinking more of where you're going out to people's houses and interviewing them. You also get the highest response rate because you make that contact in person, and you from the start can develop rapport with that person, and they're more likely to say yes, they'll do your survey. Did you have a question? You just look like, no, you don't have a, okay. You just look like you were like, I want to ask something. So because of the high response rate, you can get a more representative sample, and the federal government does a number of door-to-door surveys where they enumerate a neighborhood, and so instead of trying to get a phone number or a mailing address, they just knock on doors, and when there's an apartment complex, they can figure out all the apartments in that complex, and they can figure out which ones are occupied and unoccupied, and they can take a truly representative sample of who lives in a neighborhood, and then knock on those doors and ask the people to participate. I already talked about rapport. Because you're there in person, you can get more complete and accurate answers. You can have it's possible to do a very long survey when you're sitting with someone. You have full control over the question order, the context in which it's being asked. So if we were doing a clinic-based survey, we could hopefully set up a private room, and patients could come in there one at a time. There's nobody there, family members, other people who might be listening in a waiting room. We can really establish the privacy of the context in which they're being asked those questions. But it takes the longest time to complete a study like that because you have to interview people one person at a time. So you can also do combinations of modes. You can start with a cheaper mode and then progress to a more expensive mode. So maybe you start with internet, you get a few people over the internet, then you move on to the telephone, then maybe you send mail, then you move on to the telephone. Probably you don't actually go out to their houses, but you can set things up like that. For physicians, we've done some surveys where we might use email first and then follow up the non-respondents by mail or phone. There's a variety of different ways that we could mix and match those different modes. I'm going to skip past the rest of that. So survey development. The design of your survey influences whether people are going to be motivated to respond at all, whether they're going to respond completely, whether they're going to be thoughtful in their responses and give accurate responses, and whether you're going to ultimately get the information that you need. So steps in survey development. Typically, the first thing we do is review the literature and see what other people have done related to surveys and our research question. So you review the literature, find out what's known, and identify existing instruments. So instrument is what we call the actual survey itself, is the instrument. So we would want to know how have people asked questions about this topic in the past. We may have a desire to make the data we collect comparable for comparison purposes with data that someone else collected at another time. So that is the main advantage of using questions that other people have developed, is that you can then compare your results to their results and see, is there a trend in time? Are there different answers because from a different population than yours? It also takes a while to develop survey questions. So if there are good questions out there, it makes sense to use them. Then after identifying existing questions, we would go on and write new questions for the topics that we need, that we either can't find questions or we don't think that those questions are relevant for what we're trying to do. The next step is called clinical pretests or cognitive testing. This is where we sit down with probably 8 to 10 people and really watch how they complete our survey and whether they understand it and what might be misleading, where do they accidentally skip a question because our formatting isn't very good, where do they get confused, and so on. So once we've gone through that phase and revised the survey, we move on to a pilot test with 25 to 50 people. And with the pilot test, we're really trying to pilot testing all of our methods for that survey. So if we're going to use a particular sampling strategy, we're going to use that sampling strategy. If we have a particular protocol that we're going to use, 5 attempts to reach somebody by mail, whatever that protocol is, we're going to do the whole thing. And from that, we're going to find out how good is our sampling, how good is our protocol, and we're going to collect some data that can tell us whether our questions are working the way we expect them to work. So we actually analyze that data. The clinical pretests were more concerned with confusion about formatting and the specific questions. But with the pilot test, we really want to get some numerical data that we can analyze to see if we're on the right track with this survey. So then we would revise and finalize it. Oh, I guess I already talked about when to use existing questions. What I didn't mention is reliability and validity. So reliability is the extent to which your questions are measuring something consistently. So if I asked you today, what's your favorite color, and you told me red, and I ask you again in 2 weeks, most of us don't change our color preference every 2 weeks, I don't think. We have a color we really like. And so if I ask you again in 2 weeks, I should get the same answer. So that would be the issue of reliability. Validity is whether it's measuring what you want it to measure. So with the color example, if what I really want to know is what color of clothes do you like to wear, I need to ask specifically what color of clothes do you like to wear. If I just say what's your favorite color, I might be getting the color that you like walls painted or the color of eyes that you like to see in people. If I really want the color of clothes you like to wear, I need to specifically ask that. So that's the validity question. Are you getting the information are you measuring what you really wanted to measure? Here are a few places you can go to look for existing questions for surveys. CDC.gov the federal government does a ton of health surveys with a lot of different topics. You can go to their website and you probably will have to poke around a little bit to find the surveys, but the surveys are there. The second website here is the Kaiser Family Foundation. They do a huge variety of surveys. Some of them are about health services delivery, cost of care, access to health care. So they also have some interesting surveys to look at. You could do literature reviews. When you find a survey that someone else has done and they've reported on it in a journal, you're probably going to have to contact the author to actually get the questions. Sometimes the questions are in the articles themselves. Sort of varies. And then a really useful way to get surveys is through Google. So I just tried this yesterday with the words cardiovascular risk factor survey, and I think the second or third thing that came up was a survey that someone had done about cardiovascular risk factors. So, yes?
Is there an issue with picking and choosing different survey questions from already used surveys? And how do you, or do you need to give credit to those who originally?
Yeah, so there's a few different issues. One is credit. If they're in the public domain, it's, if they've published you have to look a little carefully, because sometimes they're published but they're still copyrighted and you can't use them without permission and sometimes paying. So psychological tests tend to be that way, where they want you to pay them $1 or $3 for each person who's going to use that. I would say more generally, people are willing to have you use their questions if you properly cite them, and you should be citing them if you're going to be publishing anything. The other part of that, the answer to that question is, when you're picking and choosing questions from a variety of different surveys, there may be people that may have done validity studies of those questions, and when you take them out of the context of the questionnaire that they were originally asked in, they may not have the same level of validity. So it's something to watch out for. I'll tell you, we do it all the time. But you're right, you do need to make sure that you have adequate permission to use something. Okay, so writing questions. So you've, at this point in your survey development, you've gotten whatever questions you might want to use from other surveys. And there are really standard surveys for things like diet and tobacco use and probably drug use. So it makes sense to use those established questions for something like that. But when you're writing your own questions, you need to take into account these four phases that people go through when they answer your questions. So comprehension, I'm going to go through these each on separate slides, but comprehension, retrieval, adjustment and estimation, and then response. So the comprehension stage is the person's understanding and interpretation of the question. So the first thing is you have to be able to read or listen to that question and know what it means and know what, hopefully everybody interprets it the same way. And to do that, you have to pay attention. So we need people to be paying attention. We need them to be reading carefully if it's written, and we need them to understand the point of the question. And we're not always good at doing that. The next stage is the retrieval stage. So the person has understood the question. Now they have to go into their brain and retrieve the information that's relevant to that question that you're asking. So some things are harder to remember than other things. Some things you didn't pay a lot of attention to, so you don't have a strong memory of. And then how long it's been is going to affect, most likely, how well somebody remembers something. So if I were to ask, how many times have you been to see a doctor in the past 12 months, some of you might have been not gone at all, and you know you didn't go at all, and that's easy to answer. Some of you might know, well, you go to the doctor once a year because you have these standard preventive care things you do, and so right off the bat you can tell me once. But other people who have chronic conditions are going more often, and it may be harder for them to estimate how many times they've been. So we really need to think about that when we design the questions. Yes?
The other problem with the questions such as this is, how many times have you been to see a doctor? Does that mean a doctor in a doctor's office, or does that include emergency or urgent care?
Absolutely. And I think I have an example of that coming up on another slide. But yes, this isn't really a very good question unless we've defined what we mean by a doctor before we ask it. Now there's telemedicine. So I actually dabbled my toe in that a few months ago to see what it was like, where you don't have to go to the doctor. They have your insurance company has these people that for $45 you can talk to them on the phone. So does that count? So then the estimation and judgment stage. So presumably by now the respondent understands the question. They've thought back in their memory about how to answer it. And now they need to evaluate the information that they retrieved and decide if it's relevant to the question that you asked. And that the doctor thing is a good example of that. So you asked me how many times I've been to the doctor, and I might have remembered, well, I went to the clinic 12 times, but sometimes I saw a nurse practitioner, and sometimes I just got my blood pressure checked, and I don't know what they really want. For attitude questions, people may just develop them on the spot, right? So we may have certain attitudes that, you know, we feel strongly about gun control or, I don't know, sidewalks. But other things that we haven't really thought that much about. And I once was called over the phone and they were asking me questions. I tend to do surveys when people call me because, well, I found that I have one of the last landlines in the Denver area. But but also because I want to see what they're doing. But one time it was a survey about whether I thought it was okay to have nurse anesthesiologists that weren't working under the supervision of a physician anesthesiologist. I don't have an opinion about that. Like, I mean, this was a general population survey asking that question. So you need to be thinking about those kind of things when you develop questions. So then the response stage. So now I've understood the question. I've retrieved the information. I've thought about whether the information I retrieved is relevant to the question. Now I have to decide if I really want to answer that question, if I really want to give that information out. Is it too private? Am I going to be judged by the person asking me the question because of my response? And am I accurate enough for what they need? So I have to make a decision about responding. And so, for example, maybe I went to the doctor 12 times, but you're asking me to put that into a lot versus frequently, and I don't know what you mean by a lot versus frequently. So, so the person needs to then make a judgment about whether they're actually going to provide the information and how to provide it. Different people are going to put different levels of energy and effort into those 4 different response stages. So we want to write questions that elicit the information that we need. We want every respondent to interpret the question in the same way. So that's the first stage. We want people to be able to respond accurately. So we don't want to be asking them questions that really, it's kind of crazy to ask. I don't know, what would be crazy? I mean, there are things that people, like my opinion about nurse anesthesiologists, that's a crazy thing to ask me. And we want people to be willing to answer. So we don't want them to be embarrassed or inhibited in giving us accurate information. So basic elements of a question starts with, obviously, with words. We want words to be simple so they convey the same meaning to all respondents. And I have an example here. So I could ask you, what are your intentions regarding getting an immunization vaccine? Or I could just say, do you plan to get a flu shot this year? Obviously, I've got more straightforward words in the second example there than the first one, but they're both trying to find out if you're planning to get a flu shot. So you want simpler words. Usually that means shorter words. For people with lower levels of literacy, the number of letters in a word makes a difference. The number of words in a sentence makes a difference. So we want simpler words. We want to include the time frame. So you can see in that second one, I said, do you plan to get a flu shot this year, which provided more specificity. So I'm going to get a more consistent interpretation of this question. And then the first one says, what are your intentions, which does not imply a yes or no answer. Who knows how we would have people answer that question. But the second one, it's a very clear yes or no that we're looking for. So phrases, we want phrases to be balanced, so both sides of an issue are represented. So we don't want to say, do you agree with something? We want to say, do you agree or disagree with the following statement? Or how much do you agree or disagree with each of the following statements? We don't want to load questions in one direction or the other. And you can just ignore that example because I remembered one when I was driving to work today that is a real question that I got in a automated telephone survey a week or so ago. Do you agree that law enforcement officers have a dangerous job? Now, is there any way to say no? I actually did say no to it because I wanted to mess with them. But is there, I mean, what do you think the purpose of that was? That was literally a one-question survey. Once they got my no answer, which required me to push a 2 on the phone, I think, because I was yelling at them, no, 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 and that wasn't working. But anyway, so we don't, and if you ever open your mail, you probably get political surveys every once in a while, and they usually, my experience, contain very biased questions that make it very hard to give the opposite viewpoint of what they're trying to prove with whatever political side that they're on. So we don't want to do that because we care about truth. The other thing I want to point out is beware of questions that have an and or an or in it. This is when you're writing them, not when you're answering them. But and I don't think the example I have here is the best one, but it's, do you agree or disagree that providing patients with nutritional brochures and a prescription for physical activity will help them lose weight? The problem with that question, well, there's a lot of different problems with that question, but there's an and in it. So if I'm trying to respond and I think that giving people nutritional brochures would help them lose weight, or I think that providing a prescription for physical activity won't, well, let's say I agree with half of that, but not the whole statement, I'm not going to be able to answer it. And so I don't think this is the greatest example, but whenever you write a question and you look at your question, you see the word and or in it, you need to take a second look and say, can people actually give one response to this? Or if I asked a question that has multiple components and I really need to split it up into separate questions. Sentences, keep them short. People are in a hurry. No matter, I know some of you won't believe me, but people will not carefully read your survey. They're gonna, if it's a long sentence, they're gonna pick out certain words and they may miss that you're asking them a negatively worded question and they think it's a positively worded question. So you need short sentences. The response options are as important as the question. I can't tell you how many times I've been reviewing someone's survey and they ask a question that implies a yes or no answer, but they have a different, their answers are not yes or no, they're whatever. So you really need to pay attention to your response options and what they say about the question you just asked, because that's part of what somebody's going to take into account when they decide how to respond, obviously. They should clarify the intent of the question. They should help respondents know the level of specification that you want. You need to make sure the response options are exhaustive. So that means that everybody can find their place in those response options. You don't want people who feel like there's no option for me. That's likely to make them stop doing your survey. So it's not just about not getting good information on the question you asked, but the whole survey then becomes, I guess, potentially they're going to stop the whole survey. You want to make sure that options are exhaustive, but you also want to make sure the categories don't overlap so someone doesn't have trouble picking which category they fall into. And so here's an example. What kind of health insurance do you have? And there are the options. What kind of problems do you see with that question? Yes? No insurance isn't an option. No insurance is not an option. That's, yes, very good. What else?
How do you select multiple?
Yeah, we didn't give them an option to select multiple. They could have multiple. Yes. What else? There's like a billion things wrong with this question.
Maybe they have a kind of insurance that isn't listed. There is something in other.
Right. So there's like the military has its own, I forget what it's called. The Indian Health Service has, yeah. What else?
They probably don't know what fee-for-service is. That's my understanding.
Yeah, I agree. Fee-for-service, I'm always kind of wondering. Plus, anybody else got any more? Fee-for-service, oh, yes.
Just that people might not know what an HMO or PPO are.
Yeah, and fee-for-service can overlap with well, maybe not with HMOs, but I think it overlaps with PPOs. So there's overlapping. Medicare, you could have an HMO or a PPO or a traditional fee-for-service. There's all kinds of overlap.
They call Medicaid
Oh, right. So in California, it's Medi-Cal. I don't know what it is in other parts of the country, but yeah. Okay, so you guys got that. Good. These are just some examples of different common response types. Our traditional, you've probably heard the term Likert. It's actually named after a person, and apparently he pronounces it differently than we do. But it's the strongly agree to strongly disagree. We can also use definitely true to definitely false, very likely to not at all likely. Frequency, we might be asking frequency, so we could have none of the time, some of the time, most of the time, all the time. Intensity, like if we were measuring pain, we might ask whether the pain was none, mild, moderate, or severe. Actually, if you're going to do a pain study, there's lots of research, I think, about how to ask questions about pain, so don't take it off this slide. But that was just to give you an idea of different responses. This is one of the main things that I correct. Well, I don't know if it's one of the main things, but I always correct this in someone's survey if they do this. So which of the following have you done in the past 24 hours? Check all that apply. So the problem with check all that apply questions is what? Does anybody know what the problem is?
They give the first answer and move on to the next.
Yep. You're going to get much higher responses at the top of the list than the bottom of the list, and people have this sort of idea about how many they need to check before it's time to move on. So they may not even read the whole list. So the way we solve that problem is we ask them to answer yes or no to each of those items. And then I have a little footnote here at the bottom, rode in a car without a seatbelt. And another thing to avoid when you're writing questions is double negatives. And this is sort of a double negative. So it's writing without a seatbelt. All the rest of them were doing something, right? And this is not doing something. So a no means a yes, I did wear a seatbelt, right? So that's something you want to watch for in your surveys, is creating double negatives. Did everybody, that make sense? Okay. Sensitive questions. So sometimes we want to ask questions that are a little bit private, and people may or may not feel comfortable asking them. And we use this term social desirability. So socially desirable behaviors are things that a person thinks everybody thinks they should do it. So maybe it's wearing a seatbelt. Everybody thinks I should wear a seatbelt. So I'm going to tend to say, yes, I wear a seatbelt, even if I don't. Socially undesirable behaviors are things that the respondent thinks other people think they shouldn't be doing. So maybe it's smoking marijuana. So we would, if the respondent believes that, they would tend to underreport smoking marijuana. And we want to try to counter that tendency to over or underreport. So one way to do that is to ask about current rather than usual behavior. So if I ask you, do you usually wear a seatbelt? Everybody's going to say yes. But if I ask you, well, the last time you took a ride in your car, did you wear a seatbelt? I'm likely to get a more honest answer if I ask him about the last time, because I'm willing to say, oh, last time I didn't, but usually I do. Another technique is to indicate that there are good reasons why somebody might not do the behavior or might do the behavior. Like, maybe if it was marijuana, we might say, well, a lot of people feel a lot of stress in their lives and just need to unwind at the end of a busy week. And sometimes people do that by smoking marijuana. When's the last time you smoked marijuana? That would be a way to sort of make it acceptable to admit that somebody smoked marijuana. We can also ask something as a series of questions so we reduce the focus on any particular behavior. So I've got some examples here. So here's an example of an introduction that softens the impact of potentially objectionable questions. So the following questions are being asked to help us understand the things that have happened to people over the years and how their lives have been affected. We really appreciate your help and that of hundreds of others who have been asked to complete this survey. So, this monitor just went off. Does that mean anything? The little Zoom thing went off. Uh-oh. I get to go till the hour, I hope. Okay, good. So the idea here is that you're saying, this is really important information. This is going to help us understand people's lives. Please give us the information we need. Here's an example of giving people excuses for why they might not have done the right thing. There are many reasons why people may not wear a seatbelt while riding in a car. For example, they may be only going a short distance. The belt may be uncomfortable, or the belt may wrinkle their clothes. The last time you rode in a car, did you wear a seatbelt? Not at all, some of the time, or for the whole ride. And so an additional thing I want to point out in this one is that we started out with the not at all. We have actually, we have 3 possible options. 2 of those are you didn't wear the seatbelt the whole time. So we're really trying to give them every opportunity to comfortably say that they didn't wear their seatbelt the whole time. And then this is an example of, I've done surveys about pap smears and mammograms, and we wanted to make sure we weren't getting socially desirable responses. If they knew that the survey was about pap smears or mammograms, they would be we thought, more likely to say they'd had one. So we embedded those in a series of other health tests that we wouldn't necessarily expect somebody to have gotten every year. So it just asks which of these tests they've gotten in the last year. And I also wanted to note on this one, when you're asking about a time frame, you want to make sure that there's not ambiguity in how you ask the time frame. So if I ask you, have you, rented a car in the last year, you might think, well, we're in September. I think she's starting with January. So she means January till now. Or you might think the last year is 2017. So you tell me how many times you rented a car in 2017. But what I really want is the last 12 months. So if that's what you want, you need to say the last 12 months and also give them the anchor for that, which I put into this question. So since September 2017. Okay, let's see. We have about 10 minutes. So questionnaire organization. So you've got your questions. Now you need to lay it out in a way that's going to be appealing to people, and they're going to want to continue, do your survey, know what they're supposed to do, and complete the survey. So you want to make it easy and enjoyable. When's the last time you took a survey that was easy and enjoyable? Okay, nobody. Anybody ever take a survey that was easy and enjoyable? Maybe. Okay. So that's our goal, is that people want to do our survey. So we start with an easy question that's salient. So it's an important question that's part of our topic. So if we tell people we're doing a survey about physical activity, and we start with the question of what's your age, that's not what we're trying to accomplish. We want our first question to be something about physical activity. But it needs to be something that's easy to answer. It shouldn't be a complex question about physical activity. We want it to be non-threatening, so the first question shouldn't be one of those questions that we think there's going to be a possibility of a social desirability bias in how people answer it. And then we want to end the survey with the difficult, threatening, and uninteresting questions, like demographic questions. So demographic questions can be both uninteresting and threatening. So I may think that you're going to judge me based on my age, or my gender identity, or my income. So we leave those till the end when people already know what your survey was about, and they're more comfortable to provide that information at the end. You want to use a logical flow through your survey. You want to group questions of the same topic together, and then a logical flow within those questions within the topic. Typically, you would go from general questions about a topic to more specific questions, but sometimes there's a reason to reverse that order. Sometimes we want to ask the specific questions, and then we want to get somebody's overall impression of something after they've thought through the specific questions. We want to use conversational wording, especially in an interview. So if we're scripting an interview that's going to be read over the phone or in person, we want that to sound conversational. We want it to flow from question to question. That means building in transitions and introductions to new topics, and they need to be specifically worded so every interviewer delivers them the same way. We really don't want interviewers making up those transitions, because that could lead to particular biases in the data that they get. I'm going to skip that one because I'm running out of time, and that was more about the opening of the survey. Changes in topic, I think I've really kind of covered that. Okay, so the formatting of surveys. If it's a written or internet survey, it should look very professional. You don't want somebody to think you typed this up 10 minutes ago or yesterday under a deadline, and now you're sending it out to people. You want to have nice fonts, nice headings, very clear skip patterns. You want it to really look professional. That'll make it easier for people to follow through what they're going to do. It'll give you credibility as somebody asking them to provide perhaps sensitive information. So you wanted people to feel like they're doing something important for an important person or an important agency. I've said before, many people don't read questions thoroughly. They don't read the content of the questionnaires in a thoughtful way necessarily. So you want to give them every possible cue to follow your flow through the questionnaire. You want to keep it relatively simple, and I'm going to actually show you some layouts of some pages. But let's see, let me first say, you don't want to crowd things. So there have actually been studies, I said 125 is the cap for how many questions you should have in a self-administered survey. I've had people say, well, if I get all 125 questions onto one page, am I going to get a higher response rate? And the answer is no. Because the font is going to be really small and it's going to be really crowded, and people are going to look at that and they're going to go, oh, this is too hard, and they're going to throw it away. And if I take that same number of questions and I spread it out over maybe 4 pages and there's more white space and a person can navigate through it more comfortably, they're going to be more likely to answer those 125 questions even though it's more pages. So it's not about the number of pages, it's how it looks and the feeling of overburden that it creates in the person. You want to use a type size that's easy in both, or I guess I should say font, that's easy in size and style. So you don't want to use these, well, if you look at it says use font on the last bullet, don't use that font that I picked out there. That's a terrible font. So you want a font that's comfortable for people to read, and you want it to be big enough. And there's a lot of young people in this room, and you'll believe me when you get to be about 40 that we really need bigger font in the surveys, we people over 40. So really be aware of that need for people's eyes changing as they age. I honestly think people don't realize that until their eyes hit that point, and then they're like, whoa, she was right all those years ago. Okay, you could use color, but all these things, tools that you could use, you want to be really careful. You don't want to overdo it. You don't want it to look too busy. Instructions should be, general instructions for the survey should be at the beginning, but specific instructions should not be given until you get to the part of the survey where they need that information. So I have an example here. This gets back to, I think it was Allie's point about what is a doctor. So I have this, when we ask about visiting a medical professional, we mean doctors, nurses, physician assistants, and nurse practitioners. You wouldn't put that definition until it's needed in the survey. It looks like there's people coming in here. So you want to give people the instructions they need, but only when they need them. Don't expect them on the 3rd page of the survey to remember an instruction you gave them at the beginning. I don't know. Yeah, I guess you can kind of see this. So this comes out of the Dillman book, which is one of the books that I highly recommend if you want to learn more about surveys. But I guess I want you to see this 2-column format. It's a really efficient way to use space on your paper. It's really clear. The questions are numbered. I don't know if you can see that from where you're sitting, but it's really clear that you're supposed to go down that side and then down that side. The numbers show you that. It says start here. The questions are bolded. The responses are not bolded, so you can tell what's a question, what's a response. It's just really a comfortable formatting, and it efficiently uses the space. This one is, well, it's from a school meal initiative, but they use this in the census. Well, who knows what we'll see. Census will be in another 2 years, I guess. But it's really clear where you're supposed to put your response in this one. There's boxes in it, and it's showing you where they want it's probably a year, and where they only need, yeses or nos. So just other ideas about responses. This one, I'm going to skip that one. Here's an example of how you can show people a skip pattern. So the yeses are supposed to go to question 2. The nos are supposed to go on to question 3. Pre-tested and pilot testing. You know what? Misha's going to talk about that next week, so I'm going to skip that. I want to spend my last 2 minutes on sampling frames and response rates. So in order to do a survey, you need a list of people you're going to survey. That's your sampling frame. And the representativeness of your results is going to be depending on how good your sample frame was, how good that list was, and how high your response rate was. So examples of a sample frame might be patients of a clinic. That is amazingly difficult to define, the patients of a clinic. Is it people who came within the last year? Is it people who came 3 years ago, but they still think they're a patient of the clinic? Finding a sampling frame for some of these things is incredibly difficult. But you need a good, complete sampling frame, and you need to know what it means in order to do a representative survey. Response rates are the number of people who respond from your sampling frame. The people who you asked to complete the survey, how many of those completed it? If you have a low response rate, you probably have bias in who responded. So the people who are more interested or bored are the ones who responded. So you really need to take effort to get your response rates up, and Misha is also going to talk about response rates next week. The other thing about response rates is efficient use of resources. If you start with a sample frame and you have a bad method of achieving a high response rate, you're going to waste a lot of effort, unless it's an internet survey. You're going to waste a lot of resources sending mailings or calling people who are never going to respond. Number of questions returned versus response rates. This is probably going to be my last point. Is sometimes people say, well, I got 1,000 responses to my survey. That's really good. But the question is, how many did you ask to do the survey? If you asked 10,000 and you got 1,000, you only have a 10% response rate. There's probably a lot of bias in who responded. But 1,000 is a lot, and you can do a lot of statistical analysis with 1,000 people. But if they're biased, then you're not going to get the right answer to your study. So you need a good sampling frame, and you need methods that are going to get a high response rate in order to create results that are really representative. Okay, and I think Misha's going to talk about that. All of these things come together to have a high-quality survey. Ta-da! We're done. There's Misha's slide, and please come next week. All right, sorry, no time for questions.
Yeah, unfortunately, I didn't realize that there is a meeting that is scheduled right now. But you could move out in the hallway.
Yes, I can hang around.
Evaluation?
Oh, I think Ellen will collect this, like I said.